I have the honor next of introducing Ms. Tiffany Taul Scruggs of Mount Sterling. She's certified by the Kentucky Department for Public Health as a community health worker for Sterling Healthcare, serving Montgomery, Bath, Nicholas, and Clark counties. As Patient Service Outreach Manager, she helps individuals and families overcome barriers to maintaining stable and healthy lives and provides resources to assist them. Previously, she worked for Gateway Community Action as the housing coordinator, serving Bath, Montgomery, Menifee, Morgan, and Rowan counties, where she enrolled clients in the Unemployment Bridge Program and Tenant-Based Assistance Program. Ms. Taul Scruggs.
All the bright lights, I'll make sure I don't pass out maybe. Good morning. I'm also going to take the microphone because I'm a mover as well too. Good morning again. My name is Tiffany Taul Scruggs. I'm the Patient Service Outreach Coordinator at Sterling Healthcare. I actually came in 2019 as a community health worker, one of the first ones to serve the area. So the task that I was handed right away when I came to the organization was transportation. We are very close to Lexington, just up 64. About 40 miles from here, 45 miles is Mount Sterling, home of Court Day this weekend. If anybody knows anything about Court Day, we're famous for Court Day, so that is this weekend. One of the things that I was given was transportation. In Mount Sterling, we had no transportation, and our rates were extremely high as far as our no-show rates and things like that. So the first thing that we were able to do was go to work on transportation. I was handed 6 sets of keys to vehicles and said, they're yours, pick up patients. So I only had 2 people, one being myself as a driver and the other one being the maintenance man. Can everybody hear me now? Okay, sorry about that. So we had 2 drivers, one being myself and the other one being our maintenance person. So we drove those vehicles and we kind of got some more people on board to help us pick up patients. So that's kind of where I'm going to start at. With given that opportunity, we grew that transportation program and it now has its own coordinator. It has 4 drivers. And I handed it off 2 years later to tackle our CHWs and make sure our Connect system was up and ready to go. So with that being said, I'm going to give you some general information on what we've done. Of course, here's our mission, and this is some of the things that we work hard at, which is our mission to improve the lives from all people in the communities that we serve. We're a 501c3 nonprofit. I think I lost a slide there. Our target population includes Bath, Menifee, Montgomery, Bourbon, Nicholas, Clark, and Powell counties. Some of the services that we have are family health, children's health, oral health, mental health, women's health, on-demand services. We have our 340B program, a substance use disorder program, and we will be in 26 school-based health centers by 2024. We have over 50 providers, and we have over 250 employees and clinics that we've combined in Mount Sterling. So now we're in our new location. So when these slides come in, they're kind of old. So we have recently moved into that new clinic, and we took 3 of our primary care locations and combined them into one. So that makes everything great. We've got about 80 employees in that new building, including some of my community health workers to help with services. We really work on care beyond our visit. We outreach to our patients to make sure they have what they need to survive, and that's crucial for our environment right now. A lot of our patients don't have food, or they may not have transportation. They may not have housing, so that's where we come into play as community health workers to get them what they need. One of the stories that I wanted to share with you, this is a gentleman right here that was one of my first patients. Is very dear to my heart. He's no longer with us, but one of the things that he needed was transportation. He walked to our clinic on a daily basis to see our chief medical officer, and they were good friends. And he was my first transport patient. And that particular day, it was raining and cold and wet outside. And Dr. Hall, our CMO, come to me and said, "Are you ready to start transporting patients?" And I said, "Well, of course, I'm ready." So we told him all about the services and how we'd pick him up and how we'd call the day before. And he was amazed that we were able to offer that service. He rode with us for 3 years, and this was his exact words to me: "I'm going to share this with everybody." And that he did. By word of mouth, our transportation grew. So when he needed a ride, he picked up the phone, he called, and he said, "Hey, I've got an appointment tomorrow." We would schedule him and go out and get him. So that was really big for our population. Some of the things that we do, we're able to help with home heating services, eyeglasses. We'll have vision in our new clinic in the next probably few weeks. So we're able to help patients with vision. One of the other things that I had to work hard on was developing a food pantry. One of the biggest things was the insecurity of food. So I'm a big Facebook guru. So anything I needed or I seen that was being given away on Facebook, I'd take it. I'm like a hoarder, literally. Anything that anybody had free that they were giving away, I took that, and what I would do was put it into a room, and I would give it back out to patients as patients requested those things. You'd be amazed what you can find. People that had Insure, things that they no longer needed, I took those items and put those back into the hands of patients that did need those. So that was one of the biggest things that we were able to do. During the holidays, we partner with a lot of our churches, a lot of our civic organizations, and we get food baskets and we deliver those. So this is one of our Sterling Health vans. We also pick up patients with that. We use it to go out and pick up things that people donate to us. So this is Jennifer and I giving a food basket to a patient. We put them on a list, and if we have 25 baskets that they give us in November, then we'll turn around and have more at Christmas, and you don't get 2 baskets. You may get one at November for Thanksgiving, and then you may get one at December for Christmas. So we try to make sure that we're not duplicating things, that all parties are served. This is our food pantry. We also have clothing in there. Anything that you could think is probably stacked up in this room. We go to CAPS in Johnson County, Christian Appalachian Project, pick up items that are donated, and we give them back out to our patients. Our transportation, again, is one of our big key programs. We've transported, I think when we first started the first year, was over 900 patients. Now that program has grown to somewhere around 2,200 patients that we transport daily, free of charge. Here's a little bit of a picture, picture of the group, sorry. We went out to an event in Powell County, and we gave away some items and did some blood pressure checks and different things to make sure our communities are healthy. Those are just things that we do on a daily basis. And that is all I have. I won't be here long. Unfortunately, I have to go back to take care of our new clinic in Mount Sterling. Our practice managers are out, so I'm the third fill-in, so I get to do that this afternoon. So if you have any questions, feel free to ask me. Thank you.